everyone, welcome back to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. If you're new here, welcome. We talk about all things rheumatology, immunology, diet and movement, and mental health and wellness because we believe it is all connected. I am a board certified internist and rheumatologist based out of Dallas, Texas, and at Connected Rheumatology we aim at providing the best, well-rounded, state-of-the-art rheumatologic care, and we believe that that includes providing education, and that is what this channel is for. So if that sounds like something you're into, please hit subscribe and like this video. Don't forget to follow us on Instagram and Facebook. We're over there too, and I always forget to mention it, but we are. And that really helps us get in front of more eyes because I know that these topics can be very confusing. And I also know, unfortunately, that the time we get with our doctor is limited. And sometimes we leave with more questions than answers. So that's what we're trying to help with here. Today, we're going to switch gears and get back into arthritis, specifically Ankylosing Spondylitis, or AS. So you guys know I like lists, so let's just get into it. We're going to be talking about the 6 things you need to know about ankylosing spondylitis. Number 1, it is an autoimmune, inflammatory, systemic arthritis. So if you've been paying attention, you'll realize I'm pretty sure I said the same thing about rheumatoid arthritis. But as opposed to rheumatoid arthritis, where the inflammation and the joint pain tends to be mainly in the small joints of the hands and the feet, in ankylosing spondylitis, or AS, as I'm going to start calling it because it's just easier, in AS, the inflammation and the joint pain tends to be in the low back, specifically the sacroiliac joints or SI joints, and the large joints. So when I say large joints, I'm talking about shoulders, hips, and knees. However, like rheumatoid arthritis, AS is systemic, meaning more than just the joints can be affected. And we'll get into some of the other parts of the body that can be affected later on in the video. Number 2. Classically, ankylosing spondylitis has been considered a condition that mainly affects only men. And although the male to female ratio for AS is 2-to-1, so yes, men are more affected, I want to highlight that women are affected too. And the reason I want to highlight this is overall, it can take patients years to get a diagnosis of ankylosing spondylitis. Studies have shown that it can take 8 to 10 years of patients bouncing around between doctors before they're finally diagnosed with AS. Now, there are probably a number of reasons for this. The main symptom that can present as AS is back pain, and we know that back pain is very common and is oftentimes just dismissed. But the reason I want to highlight that this can happen in women is that diagnosis delay is even longer for women, and specifically for women of color. Again, because the presenting symptom can often be low back pain, it is not uncommon for women and people of color to be dismissed. So yes, ankylosing spondylitis happens mostly in men, but it can definitely be seen in women, and I would even gather to say it's probably seen in more women than our studies even appreciate. Number 3, AS is not simply RA of the back. Now, I know that it might seem on a very basic level that it's just the same thing as RA except it affects the back, and you might have even had it explained to you for simplicity. In fact, I think I've even explained it that way to patients, just for simplicity's sake. But the truth is they're actually very different. Just as a little bit of history, in the 80s and 90s, new molecules and new treatments were coming out for the treatment of inflammatory arthritis in RA. And since then, these treatments have completely changed the game when it comes to treating RA. So when these new medicines came out, it was natural that everyone hoped and wondered if these new medicines would be effective in all of our different inflammatory arthritis types. And it became clear right away in some that they do not. So for example, in lupus, these new medicines did not work, in fact, might have made it worse. But in things like AS, the result was a little more mixed. In some patients, these new medicines did seem to help, but there is still a very large portion of patients with AS that these new rheumatoid arthritis medicines didn't help at all. Thankfully, the scientists and the researchers went back to the lab and took a closer look specifically at patients with AS and similar type conditions and found that at a cellular level, what was driving the inflammation was completely different than what you see in rheumatoid arthritis. Hence, that's why the medicines didn't work as well. So yeah, AS is not the same as rheumatoid arthritis. Number 4, AS is a condition under the larger umbrella of conditions known as seronegative spondyloarthropathy. I know. It's a crazy name, but just stay with me. So seronegative simply means that there are no antibody positive blood tests. So no rheumatoid factor, no ANA, nothing like that. Spondylo is back, arthro is joint, pathy is disease. So spondyloarthropathy simply means disease of the back. So seronegative spondyloarthropathy means these are diseases of the back that have negative blood work, negative labs. And there are a lot of conditions that fall under this umbrella. Things like ankylosing spondylitis, psoriatic arthritis, uveitis, inflammatory arthritis associated with inflammatory bowel disease. It can seem like these conditions are just a hodgepodge. And if you're confused, you're in good company, because a lot of medical students, internal medicine residents, and even rheumatologists can be confused. Now, I tend to not think of these as discrete conditions that sit under an umbrella, but more as a spectrum, meaning that a patient that's diagnosed with any one of these conditions at any given point in time can then develop features of one of the other conditions along that spectrum. So for example, a patient may be diagnosed with ankylosing spondylitis. 1 month, 5 years later, they develop psoriasis. And then maybe they develop eye inflammation, that's uveitis. Maybe then they develop inflammatory bowel disease. These are all conditions that reside along that spectrum of seronegative spondyloarthritis. And this is just another way that these conditions are different than rheumatoid arthritis. Does that make sense? I hope it makes sense. All right, number 5. So how do you know if your back pain is inflammatory or not? You know, to be able to distinguish between the standard, very common low back pain that a lot of us will experience throughout our life versus the inflammatory back pain that's associated with ankylosing spondylitis, the key is really in asking the right questions. So ask yourself, when you wake up in the morning, how easy is it for you to jump out of bed? It's not uncommon to have some stiffness. But if you have an inflammatory back pain, that stiffness can last upwards to an hour, maybe even 2. You might even need a warm bath, warm shower, and an ibuprofen to get you to moving more comfortably. The other question is, once you are comfortable, once you're moving, how do you stay comfortable? Those with inflammatory back pain find that they just need to keep moving and they're fine. So they like going to the gym. They want to go on walks. They do not want to lay down and rest, and they don't want to sit at a desk, because laying down and sitting down for long periods of time will stiffen up their back and cause a lot of pain and inflammation. Whereas the more common type of back pain due to muscle spasms or to arthritis of the back, that makes people just want to sit and rest. Going to the gym sounds like torture. Ask yourself, what makes you feel better? Keeping active, keep moving, or just resting? The other key is actually outside of the back. Are there any other symptoms that you're experiencing that have nothing to do with the back pain? Those with ankylosing spondylitis might find that they get the random shoulder pain or knee pain. They can get swelling and tenderness along their Achilles tendon in the back of their heel. It might seem random at the time, but people who have kind of run-of-the-mill back pain will typically not also notice these other joint problems. And skin issues, stomach issues, eye issues, these are all things that you should think about and that your doctor is going to ask when trying to figure out if your back pain is inflammatory or not. And number 6, genetics plays a big role in the development of AS. Now, to be fair, genetics plays a big role in every autoimmune condition in ways that we don't really understand yet. But I bring this up with ankylosing spondylitis because one of the blood tests that is often run is a genetic marker called the HLA-B27. Now, this gene produces a protein known as the HLA-B27 protein that is involved in the development of AS in ways that we don't know or understand. But what we do know is that 90% of patients who have AS will have this gene. But the majority of patients who have this gene do not have AS. So that means that most people walking around with that gene will not develop AS. So what does this mean? Well, it means that if we have a high suspicion or we're very worried about the development of AS, we will check this gene. And we know that if one person in the family has ankylosing spondylitis or psoriatic arthritis, uveitis, or any of those other seronegative spondyloarthropathies I talked about, that everyone in their family has a higher risk of developing these conditions as well. But that doesn't mean we go around checking their genetics. Again, how the presence of this gene leads to the development of AS, we don't know. Is there interaction with the microbiome? We don't know. Is there some interaction with another virus, another bacteria? We don't know. All we know is that there is an association between having AS and having this gene. All right, so those are my 6 facts about ankylosing spondylitis. I hope you found some nuggets of information here. I hope it wasn't too confusing. This topic is confusing even to medical students. The classifications of these types of arthritides can get a little wonky. It's certainly not as clear cut as something like rheumatoid arthritis, but I hope you found some information, jotted some notes down, thinking about things that then you can discuss with your own doctor, because that's really what we aim to do, is just get you thinking about your symptoms, letting you know how the doctors think about these things, so then you can have some more effective conversations between you and your own doctor. If you like this video, please give it a thumbs up. Don't forget to subscribe. That helps us get in front of more eyeballs so that more people can have their questions answered. We talk about all things rheumatology, immunology, diet and movement, mental health and wellness, because we believe it's all connected. And guess what? We talk about that stuff over on Instagram and Facebook too. So if you haven't yet, please go follow us over there and have a great day.